Hi everyone, I am Michelle de Claveria, student nurse from Nueva Ecija University of Science and Technology, and today I am going to demonstrate the assessment of 12 cranial nerves. As we all know, nerve is very important. It helps detail minute of our life, and if it is damaged, it brings permanent impact to our lifestyle. So let's start with the assessment. First is doctor's order, client's level of consciousness and level of knowledge and understanding, and availability and functionality of the needed materials, assess mental status or ability to participate in the procedure. For the planning, if possible, determine whether screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipments, and timing. Prepare the equipments. First is the wisp of cotton to assess light to touch sensation, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, and queen flavor percussion, tuning fork, tongue depressor, paper clip, pen light, and clean gloves. Hi ma'am, I'm Rochelle de Claveria, your student nurse for today. May I know your name?
I'm Kristen Garcia.
And when is your birthday?
August 28, 2008.
By the way, ma'am, the procedure that I am going to do is to assess your cranial nerve to know if there's an abnormality. I will be touching some part of your body and there's some movement to follow. Is that okay?
Yes.
Okay, do you have any clarification? Okay, thank you. So let's start with the first assessment. The first procedure is the first cranial nerve or also called olfactory nerve. First, ma'am, you should clean your nose. And I want you to close your eyes and close one of your nostril. And I want you to smell this and describe. Okay, what is this?
A coffee.
So now the patient is able to describe this thing. So now let's proceed to the second cranial nerve, the optic nerve. Ma'am, I want you to cover your right eye and then read this.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC.
And I want you to cover your left eye, then read again.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC.
So, thank you. So now let's check for the visual acuity using the Snellen chart. The client will stand 2 feet away from the Snellen chart. Ma'am Christine, I want you to cover your right eye and then read.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC.
And I want you to cover your left eye, then read again.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC.
The patient can see 20/20 near and far vision. So for the third assessment, let's check for the cranial nerve 3, 4, 6, the oculomotor, trochlear, and the abducens. So first, check the eyelids. They should not be obscured vision, and check for the pupils. And the pupil is round and equal size. Okay? Then, so now check for the pupillary reaction by shining the pen light to the eye. Okay, place the finger 10 centimeter away from the patient. Christine, I want you to stare at my finger. Okay. Last, check the extra movement in the 6 cardinal direction. Upright, up, down, vertical, down right, and down left. So Christine, I want you to stare this pen and follow my direction. So for the oculomotor, the pupils are round, equal, and reactive to light and accommodation. So for the trochlear, both eyes move into the direction indicated as they follow the examiner's pen light. So for the obtusans, both eyes are moved in coordination. So for the fourth assessment, the fifth cranial nerve or the trigeminal nerve, the mandibular maxillary ophthalmic division should tested symmetrically for the pain, light to touch temperature. So for the pain is Q-tip sharp, then ask the patient to close your eyes. So Ma'am Christine, so can you close your eyes? Then tell me if the pain are symmetric.
Thank you.
So let's test for the light to touch. Use a wisp of cotton. So now let's check for the corneal reflex. Christine, I want you to look up away from me and tell me if you feel the touch of the cotton. So the patient feel the touch from the head, maxillary, and mandibulary areas. So for the fifth assessment, the cranial nerve 7 or the facial, Christine, I want you to smile, raise your eyebrows, frown, puff out cheeks, and close your eyes tightly. As you can see, the patient can smile, raise her eyebrows, frown, and puff out cheeks, and close her eyes tightly. So now for the sixth assessment, the cranial nerve 8 or the vestibulocochlear to assess for hearing. And first is the ability to hear the words. And I'm going to whisper a number or a words such as 99 and baseball. I want you to repeat after me, okay?
99. 99. Baseball. Baseball.
Okay. So for the second is the vibration. To test the Weber test using the tuning fork. Okay. So tell me if you hear the vibration. Okay. So for the test of the Rines, tell me if you hear the vibration. Okay, thank you. So as you can see, the patient can hear the whisper words and hear the vibration. So for the seventh assessment, the cranial nerve 9 and 10, the glossopharyngeal and the vagus. Christine, I want you to say ah and open your mouth. Ah. Okay. Then test for the gag reflex one at a time. Casey, open your mouth. This may hurt you a little. Okay. Ah. Then ask the patient to swallow. Can you swallow? Okay, then repeat. Okay, thank you. So for the glossopharyngeal gag reflex is present and the vagus, the patient can swallow and speak without difficulties. For the 8th assessment or the 11th cranial nerve, the spinal accessory, Casey, can you turn back? And I will remove your gown. Can you shrug? Then evaluate the strength and the contraction on the upper trapezius muscle. Ask the client to turn her head back side. And Casey, can you look up and down and right and left? And So the patient can shrug her shoulder and turn her side to side against resistance. For the ninth assessment, the 12th cranial nerve or the hypoglossal, basic, can you please open your mouth? And can you put your tongue out, then move right, left, and down, up? Okay, thank you. As you can see, the tongue is in the middle and it can move without difficulties. For the evaluation, evaluate the patient's response to the procedure and document the procedure and the important data on the client's chart. Thank you.